right, here is a question, modifier for assistant RNFA surgery. So Stephanie wrote, hello, I have a question. I'm having trouble getting my second assistant paid. The main surgeon bills charges, we bill duplicate charges, but two assistants from the same group help the surgeon. Both assisted. My question is for my first assistant, I use modifier AS, but I'm having trouble getting my second assistant paid. They state for second assistant I need to use correct modifier, but I don't want to use a surgeon modifier because this is an assistant, a PA. Even when I appeal with records, they state I need to add a correct modifier. Can you help me with this? Okay, so here we go. Assistants at surgery modifiers. So I found a good but dated, I think it was from 2009, article on the AAPC about these assistants at surgery modifiers. And basically, you're going to have modifier 80, I'll show you the choices first, 81, minimum assistant, 82, assistant at a teaching facility, and AS, this is the one that she was talking about, which, by the way, it took me a while to figure out her question because she didn't have AS capitalized, and I kept going, I use modifier as, but so I finally figured it out. But so do us a favor when writing questions, capitalize when it's important. Okay, so let's review what this is telling us. So modifier 80 is the typical modifier you think of for assistant surgeons. You have a primary surgeon billing a procedure, and then you have someone that's assisting that primary surgeon. They both use the same CPT code, but the assistant puts an 80 on their code. And the payers, private payers, will typically pay 20 to 25%, and Medicare pays like 16%. Okay, now Medicare has on their website, the CMS website, a Medicare physician fee schedule database, something like that, and they've got columns for every single HCPCS code, meaning HCPCS level 1, which is your CPT codes, and HCPCS level 2, which is the HCPCS level 2 manual. And next to all of these, they will let you know a whole bunch of things about the code, but there is one about assistant at surgery. You'll also find it in your encoders like Supercode or Find a Code. All of those will take that Medicare CMS, that table, and put it into just a more user-friendly format. So not all surgery codes warrant having an assistant. So it doesn't mean that you can't have an assistant help, but it doesn't mean that they will pay for it. So it's all about medical necessity. And when you get on the CMS site, you'll read things like they do studies to see how often assistants are needed for a particular procedure. And if it's not that often, then they will, in future years, probably not allow it. Okay, so that's 80. Now here's a little blip about Medicare and modifier 80. If they restrict the use of it to the primary procedure, so if the physician, the primary surgeon, did more than one procedure, they're only, for Medicare, letting the assistant bill one of them, the primary one, with modifier 80, and they get 16% of the fee schedule. Now there's this other minimum assistant at surgery. Medicare doesn't recognize this, but some private payers do, and they put 81 on. It's kind of like like a pecking order, and I've always explained it in my modifier lecture that they're kind of like your openers and your closers. They don't stay for the whole thing. Modifier 82 is exactly the same as 81, except it's used in teaching facilities, because the idea is in teaching facilities they're supposed to be using residents. Residents are doctors, but they're doctors that you can't bill for yet. So teaching facilities get paid more, and therefore, with the expectation that the residents are assisting. Now, if in your facility there are no trained residents to assist for that surgery, then they will let a non-resident physician be an assistant, and they have to use modifier 82 because it puts the onus on them to say, we've got documentation that none of the residents that we currently had on staff were qualified. Not that they were busy, not that they were doing rounds or getting a Coke down the hallway, that they were not qualified to assist, and therefore a non-resident physician came in to assist. I used to say a real physician, but that's not very nice because residents are definitely real physicians. They're just newer and they can't be billed for yet. Okay, So that's how Modifier 82 works. Now Modifier AS, Assistant at Surgery, these are for your PAs, your physician assistants, your NPs, nurse practitioners, or clinical nurse specialists. They can also be assistants at surgery, and they're identified by putting an AS after their surgery code. Okay? This modifier may only be submitted with surgery codes, and additional documentation is required. And this is the documentation, according to this article, that they're looking for: a statement that no qualified resident was available, a statement indicated that exceptional medical circumstances exist, a statement indicated the primary surgeon has an across-the-board policy of never involving residents in the preoperative, operative, or postoperative care of his or her patients. So, actually, I think that's more for the 82. So there are some, limitations with this, but this is a good article, and let me click on the link so you can see it in context. So it's the news.aapc.com, and oh, it's 2008. It's taken a while to come up. So while it's doing that, just to go back to the question, when I looked at what people were saying on other discussion boards, they were kind of like, you really can't bill for 2 assistants except in rare circumstances, like some, very complicated, cardiothoracic procedures. Is it allowed? And oftentimes you have to send in documentation. So what I suspect is going on here for you, Stephanie, is that they just aren't considering the second one medically necessary. So I would bill the ones that build the one that would give you the most return. So if you have a non-AS physician, then I would use the regular 80 code before the AS.
Get more CPC exam tips, coding certification training, and CEU credits. Go to www.codingcertification.org.